Welcome everybody to the Garnet Health Self-Care Forum February edition, and in honor of Heart Month, we are talking about heart health. So we have Garnet Health cardiologists team here, as well as the American Heart Association present. So starting with Dr. Patel, a little introduction. He received his medical degree from Medical University in Lublin, Poland. Dr. Patel completed his internal medicine residency at Mercy Hospital in St. Louis, Missouri. He completed his fellowship training in cardiovascular medicine and at Creighton University School of Medicine in Omaha, Nebraska. Christina Hahn, our family nurse practitioner in cardiology, obtained her master's degree in nursing from Columbia University School of Nursing in New York, and her bachelor's degree in nursing from Seton Hall University in South Orange, New Jersey. Chris Costello is a registered nurse who's worked at Garnet Health for the last 29 years. He received his BSN from Mount St. Mary's College and his master's in science and nursing executive from Chamberlain University. He's a board certified occupational health nurse specialist. Chris was selected as the Garnet Health 2020 recipient of the B Award for his work keeping our staff safe during the pandemic, and he was asked to serve as the chair of the 2021 AHA Tri-County Heart Walk event. Eleni Smalley is the Senior Development Director in the Hudson Valley for the American Heart Association. Eleni has been with the AHA for over 3 years and has spent the last 2.5 years working in this region. She oversees the Hudson Valley, including Dutchess, Ulster, Orange, Rockland, and Sullivan counties as our community partners. Eleni works specifically on the Tri-County Heart Walk to ensure a longer, healthier lives for all. So, I think I stopped sharing now. To get started, our first question for the panelists are, according to the CDC, heart disease is the leading cause of death for men, women, and most racial and ethnic groups in the United States. What are some of the risks that are out of our control?
So we can just start off just as a discussion. So there are many risk factors that we ourselves as individuals can control. The basics start off from when we're young, just learning our basic eating habits and appropriate dietary intake, because that does contribute a large risk factor to not only cardiovascular disease, to also other diseases that lie kind of within that spectrum or can cause complications for patients with heart disease, such as diabetes, uncontrolled high blood pressure, which dietary changes can also help reduce these risks as well. Another big thing that we can all do is not take up any unnecessary habits, such as smoking. As we know, that does increase your risk significantly for underlying heart disease, in particular coronary disease, other such diseases that can come from that, heart failure, things of that nature, and as well as just staying active and exercising your heart. Right, Christina, any other recommendations that we can give? And so those are 3 of like the most basic and easy ways to start. Hello.
Hey, Dr. Patel, thanks for joining us. Panelists, or excuse me, Dr. Patel, thank you for that comment, Dr. Patel. Dr. Enkatia, thank you so much for joining us. Community, Dr. Enkatia received his BS in Honors College at Stony University and his MD from State University of New York in Syracuse. He completed his internship and residency at the University of Virginia Health System in cardiology training at Edith and Benson Ford Heart Vascular Institute in Detroit. He's a member of the American Heart Association and a fellow of the American College of Cardiology. Thanks for joining us, Dr. Enkatia.
Thank you.
We were just talking about the risk factors that are out of our control for men and women, and racial and ethnic groups.
Yeah, so part of it is genetic, actually. Sometimes, you're born with it, your mom, your dad, your family has it in your family. And that can actually come run into the family to the daughters, to the sons, the kids in the family. So that can actually happen. Sometimes that way you have no control over that.
Yeah, and I would also say that one thing that we talk a lot about with the American Heart Association is how women and men react differently to things. And so we see a lot of that, and we focus a lot of our education on making sure women know that even though their signs and symptoms are different and not the traditional ones that they would see, to still get it checked out and make sure that they're taking care of themselves.
And especially other things like hormone fluctuations and things like that, that we know women who tend to undergo menopause a little bit sooner or so can tend to be at a higher risk for developing underlying coronary disease earlier than, say, their counterparts who may undergo, say, menopause at what an average age should be, or possibly later within their life as well.
Christina, we can't hear you. We see that you're talking, but we can't hear you.
Okay,
can you hear me now?
Yes.
Yeah.
Sorry, I was just going to say that along with what Dr. Patel said, there are things like having an autoimmune disorder that's out of your control, but that's going to increase your risk of developing coronary disease, especially early, something like lupus. Those are people we have to be really careful with. They do have more risk, and it's completely out of their hands, even if they do everything right.
Mm-hmm. And also along those lines too, say certain patients who have undergone chemotherapy, radiation therapy as well too, that can do some damage to the lining of the arteries, cause some inflammation there that predisposes you at those risks and those inflammatory risks for developing atherosclerosis as well.
Absolutely.
Wow. Are there other risk factors that lead to heart disease?
So basically, like as Dr. Ankatea pointed out earlier, the ones that we have no control over. So those are things that we just have to follow the patient, get good detailed history regarding their family history and kind of onset of disease, at least within all first degree relatives, and then branching out into different lineages as well too. But then we hashed over some risk factors we can control. Like we said earlier, Dr. Ankatea, before you're in, lifestyle changes are big factors that us as patients can control over ourselves. Eating habits, smoking, cessation usage of tobacco products, alcohol use, any type of illicit drug use, substance use, and then controlling your other risk factors that you have. Anything else that you may have to add on to any of those controllable risk factors that we ourselves can take care of?
Right. Some of the things you look for, maybe if you're overweight, you want to lose some weight. If you have high blood pressure, you make sure that's controlled. If you're diabetic, also make sure your numbers are going down. And that can also help as well.
Yeah, that brings me to my next question, actually. The American Heart Association talks about being healthy for good with the Life Simple 7. The Simple 7 are get active, eat better, lose weight, control cholesterol, manage blood pressure, reduce blood sugar, and stop smoking. So what are some physical activities that are beneficial for heart health, and why is it important?
Well, I'll jump in early. Any activity is good. The important thing is to start and to sustain and to build on it. You're not going to start walking out the door running a marathon, but you need to start walking. 15 minutes a day, commit to it, continue to do it, sustain it. Ask a friend to join you. Whatever helps you to keep it going is the best thing. Same thing with all your dietary changes. Don't try to change the world at once. Change one small thing, sustain it, then add something to change. That's the key to making it a long-lasting success.
All right. So talking about exercise, I think it's very important. People think you have to exercise, you have to work out. So that's very good. But some people, they cannot go out and walk. You can do swimming, you can do weight. They're all very, very useful.
Ironically, it doesn't have to be cardio to get cardiac benefit. You can
Right.
lift weights, anything to get your heart rate up. And
Mhm.
actually for us, it's kind of multifaceted. It's good for your heart and lungs to exercise, but it's also going to catch potential symptoms sooner. So if someone is doing like a 3-mile walk every day and they're saying, oh, Christina, I'm short of breath on my walk now, as opposed to I'm short of breath when I got off the couch today. So that's a whole different level of symptoms. So the more active you are, the sooner we're going to be able to catch some symptoms brewing, like shortness of breath or chest pain.
Mhm. And also at least a moderate level of intensity. You're generally walking around the grocery store, that's great. You're doing it, you're moving, but at least for about 30 minutes or so, if you can get your heart rate up to a little bit more than what you would at just say moderate or a medium level of intensity, even if you're used to just walking, at a very slow pace, increase that up for a little bit of time and just gradually start making those changes as you can.
We talk about it, purposeful increases. You do your daily stuff, but then you might walk up a couple extra flights of stairs purposefully to get your heart rate up to start to build up your strength and your stamina.
Yeah, and I'll say too, with the American Heart Association, we have our Heart Walk coming up in May. And one thing that we've actually incorporated this year is a activity tracker that goes live 30 days prior to the event. So you can, with your Fitbit, with your Apple Watch, whatever kind of device you might have, even with your phone, it can track your steps. You can compete with others. It's a great way to just get started and get active and just to start moving. So all of those are great options just to kind of kick things off and get your heart a little bit healthier.
Wow, great. How does our diet influence heart health?
That's a big one, actually. There's a lot of diet, on the market. Jenny Craig, there is the keto, there is that. I think from my standpoint, you have to start in small increment, right? So most people, it's portion size, portion control. That's the first thing you have to do. Then maybe you can start cutting down things that you have in excess. For instance, if you have more portion of carbs, you may start cutting down that. Then at some point, you're gonna cut other stuff once you get to your goal. Diet are very good. I tell my patients just begin to just cut the carbs away. If you're eating bread, rice, nachos, all this stuff every single day, maybe it's time to just cut it down a little bit more. Then at some point, you can keep cutting down until you get to your goal.
Yeah, I'd also like to add that there is like a really strong feeling that we have to eat low fat foods to benefit our heart. And the problem with low fat is it's not only not good for you, but it leaves you really, really hungry. So people are really hungry and snacking more, and they're not losing the weight that they need to lose to lower their risk factors. So I'm usually having to really encourage my patients to include healthy fat in their diet and reduce a lot of the processed foods that Dr. Nkatia mentioned, things like breads and pastas and rice. Not that all carbs are necessarily bad, but we want to avoid those really processed things that are just going to help us gain more weight and have more risk factors.
And also taking into account of other risk factors or so that you have, your diet might change based on those needs as well too. Say if you're a patient who also has heart disease or have kidney disease as well too, your dietary options could be limited. Say if you're also diabetic, like Dr. Ankite also hashed on low carbohydrate diets and that. But sometimes when you transition to that, patients think, oh, it's okay for me. I'm going to go on the keto diet. I can just eat bacon all day long, which, that is a misnomer. Like how Christina said, fats, yeah, they're good. And knowing what type of fats that you're taking into your body and which ones are the good fats that are going to help you out, that your body's going to utilize versus the bad fats that are going to get taken up by the liver, get recycled in and get processed out. And then also things that you can do to help eliminate some of these fats out of your body. Always increase your fiber intake so that you're helping yourself, you're helping your gut, and that release all those extra fat molecules that your liver's releasing to help digest food.
But the key to every diet is that you have to talk to your doctor first. So before you start any diet, make sure you talk to your primary care, your cardiologist, just to make sure it's the right diet for you. If you're diabetic, right, and you go straight keto, you're gonna have low sugars, you're gonna be passing out, you're gonna be dizzy. So before you start any diet, talk to your doctor to make sure you're okay with it.
And same thing with the exercise plan as well too. If you're already having symptoms or so, like how Christina was saying, You know, that might be a time where you need to take a break, pause, get on the phone with your doctor, let them know what's going on, especially your primary doctor. And if there's things that they need to address you, they can always send you guys our way here to further evaluate what's happening.
Yeah, and we talk a lot about eating the rainbow too, and getting a lot of different colors of, in your diet, and picking out different fruits and veggies and kind of making it fun for your family in terms of eating things, that are a lot of different colors. And we always say, like, make your plate as colorful as it can be. So that's another great tip that I feel like it's easy to incorporate with the families and the kids as well.
Another thing too, you may have heard how people say when they go grocery shopping, they'll stick to the side of the grocery store.
Yes.
Where inside in the aisles, that's everything that's in boxes, doesn't need to be refrigerated, kept. So that means that's going to stay on the shelf. So that's got preservatives, salts, other types of processed salts or so that can really, the body's not used to and doesn't really know how to even process that stuff.
A lot of our supermarkets locally also have a nutritionist based in the store where you can set up an appointment to learn how to shop so that you are shopping for the nutritious stuff and avoiding some of the pitfalls that we always fall into.
Great, great. What effect does weight have on your heart?
That's a very good question, actually. So basically, if you're very overweight, it's a lot that can go on. So there's something called metabolic syndrome. That's one. That means that your cholesterol levels may go up. Your sugars are going to go up as well. Your blood pressure is going to go up as well. Your arteries are going to be stiffened. All of it actually can cause a lot of plaque or a lot of plaque buildup in your arteries, and probably at some point block it in your heart.
Mm-hmm. And also depends on the type of weight gain, healthy weight gain opposed to unhealthy weight gain. If you're putting on a lot more body fat in a sooner percentage of time, because we know that the adipose in the blood, or the adipose in the body, has a metabolic effect too, where it secretes its own hormones that kind of reproduce, telling your body, you need more fat, you need to do this. And then the extra weight in that you're putting on the body has to supply more blood vessels to kind of perfuse this to where things are going. So that puts more strain on the heart to have to circulate this. It puts more strain on the heart having to pump more blood through the body. And a lot of times these patients also start experiencing elevations in their blood pressure related to the weight gain, which that's going to in turn put more stress on the heart, which puts more stress on the artery walls itself, which leads to damage of the walls, which leads to inflammation, and like Dr. Ankita had mentioned, further atherosclerosis and plaque buildup.
Wow. Okay. So you guys actually both mentioned it.
Yes, the last thing I add is sometimes people that are very overweight, it's hard to actually help them with a lot of cardiac testing and the thing that we do in our hospital. Sometimes somebody's so overweight, it's hard to get them the scanner to get a CT scan or a stress test or even cardiac catheterization. So I think for someone like that, you always have as a big disadvantage actually because of the weight actually.
You guys both mentioned controlling cholesterol and blood pressure. Let's talk about that a little. What are some dangers?
So actually the best way to control cholesterol is with weight loss. So being overweight is going to predispose you to having higher cholesterol levels. It's actually not as directly related to diet as I think people think. If you're a healthy weight, it's okay to, eat an egg, which is classically like a high cholesterol food. It's more important that you lose the weight to keep your cholesterol down.
And also with cholesterol too, if say you have a history of alcohol use, smoking, things like that, which are lifestyle things that you can work on, those have been shown to also help just by stopping those habits to reduce your cholesterol numbers in that as well too.
Yeah, and I would say one thing we always encourage people to do, and when we kind of talk to people, we always like to ask, do they know their blood pressure? Because I feel like a lot of people get it done once a year at the doctor, and we're encouraging more and more to get it checked more regularly because, especially, if you're only going once a year, there are spikes that can happen and very dangerous things that can lead to stroke and other, downfalls. So we want to make sure that people are getting their blood pressure checked frequently. And we're trying to implement more programs within the community to give those resources out to people.
And this can be done by having an outpatient machine at home. Or if you can afford it, you can go to your CVS, your Rite Aid, your Walmart to get it checked. It's okay. You can send it to us. We can take a look and try and look at what we had in the office compared to what you had at home.
Yeah. And that's why they say hypertension is a silent killer, because you don't know it, because you can't feel the symptoms or so of high blood pressure at times.
What's a healthy blood pressure?
So that's also a good question too. So those can also vary based on patient's age, other medical conditions that they have, and other comorbidities. So patients who are higher risk, who have a known history of coronary artery disease, who are diabetic, who've had strokes, we like to be a little bit more due diligent at controlling their blood pressure. Their ideal goal, top number systolic, keeping it closer to 120 as much as we can. Bottom goal, keeping it closer to 80 to 90 as much as we can. While other patients, 130 or so is not completely unreasonable if it's a healthy young patient who you're just following and they're just seeing you for regular health maintenance or so.
But the key point is that it has to be individualized, right? So not everybody can be 120/80, 120/90. Some people, if you give blood pressure 130, they are dizzy, they are passing out, they're having changes in alimentation. So talk to your doctor, make sure there's a right range for you, right? Everyone is different. I'm different. Dr. Patel is different. Krishna is different. Chris here is different as well. So make sure talking to your PCP, your cardiologist, make sure they agree with that goal that you have. So your goal may be different from my goal.
And if you know your numbers, it's important when you see them change to talk to your provider to find out why they're changing.
What are things that can cause them to change? I know we talk a lot about diet. We're talking a lot about physical activity. What are some of those things that can cause the change?
So like you said, on that, diet can be a big one. So if all of a sudden now your diet has changed, you're working a lot more, you're relying more maybe say on frozen dinners or so, not noticing it, and all of a sudden your blood pressure is a little bit more increased. Other things that can take effect as well too, how your stress levels are, your emotional state and well-being as well too plays a big role, because that is, your body sometimes can just be in a heightened state of arousal, and your hormone levels that kind of help control the blood pressures or so might be a little bit more elevated and reacting at those times.
Wow.
Yeah, some of the things that you want to make sure you have is check your thyroid, make sure it's not too high, it's not too low. Make sure your salt intake is very important, right? So people with a lot of canned food, from the cafeterias, make sure there's not too much salt in your diet. Some people actually are called salt responsive, right? In other words, little salt actually can get the blood pressure so much higher than it is usually. So make sure you're looking at what you're putting in your body, how much salt is in the food, where's the food coming from.
Great. The last of the Life Simple 7 is stop smoking. So how does smoking influence your cardiac health?
Christina.
Well, we know that smoking can damage your lungs, but it also has a big impact on your heart. It causes a lot of inflammation and promote the atherosclerosis buildup on the arteries of your heart. Those plaque buildup in the arteries of your heart is what leads to heart attacks. It can also contribute to arrhythmias and lung disease because of the problems and the inflammation in your lungs. This can cause arrhythmias like atrial fibrillation, which can cause even a stroke.
Mm-hmm. Just like you can think of it, if you have a chimney in your house, you're burning logs or so, you have to periodically get that chimney cleaned out or so, right? Because of that soot and stuff that's building up against that chimney wall. You can think of that the same way as what's kind of happening inside your artery walls as well too, with that smoke that you're taking in. but we don't have chimney sweeps that can go into your arteries. Well, we do that.
Not yet.
That's no cardiologist, but
So American Heart Association, as well as Garnet Health, has a Freedoms from Smoking program that can help patients and people to get through that process. It's a long, arduous, it's an addiction. So it takes some time to get through it. And the Freedom from Smoking program gives you the tools to get through that, some of those obstacles that everybody faces when trying to quit smoking.
there are many options, just like how Chris was saying, especially to at least get started and find the right path. You have options that we can use that can help you wean off of the nicotine or so, since it is an addictive substance, other medications that we can prescribe to your pharmacy that can kind of help aid in your quitting smoking or help keep you successful in the process of quitting smoking.
Yeah, and I just want to touch on really quick, another thing that we're focusing on a lot at AHA is vaping and the issue of vaping, especially in schools. A lot of younger kids are starting vaping without realizing that they are inhaling tobacco, which is always a shock. But when they come in flavors like creme brulee, I can understand how kids can be attracted to it. But so one thing that we're really trying to do is focus on the education around, for the parents and for the teachers to know that, what's in these, e-cigarettes that they're doing. And actually, we just worked with our advocacy department to make sure that we removed the flavorings. So New York State as a whole lobbied to remove the flavorings from e-cigarettes and I think like all tobacco products. And additionally, we are trying to have that include menthol as well, which we have found to be a little bit of a gateway into tobacco use.
Wow.
Yeah, I try to tell our patients that basically inhaling anything is bad. There's definitely a sentiment, like you mentioned, that this kind of smoking is okay, and at least it's not tobacco because it's flavored a certain way, and the smoke smells better and it's more pleasant. So therefore, there's a feeling that it's not harmful. But we do see even young people developing lung disease and really severe pneumonias because of vaping, and they're doing it very freely and very regularly, feeling like they are not getting the risks that you get traditionally with smoking tobacco and cigarettes. But it is very dangerous, and it's a big problem.
What are some signs and symptoms that should alert a patient to see a cardiologist?
Chest pain.
Yeah,
So chest pain is a big one. We see people for chest pain 50 times a day, every day. So one of the first things that we ask when someone says oh, I have chest pain is, what are you doing when you were getting it? Were you sitting, watching TV, resting? Were you climbing stairs? Were you exerting yourself? And I think any doctor or cardiologist is going to be more concerned about someone who has to stop what they're doing because of the pain.
So, and basically anything that may seem atypical to you, especially knowing what your family history and that is, and say if your father had a heart attack at the age of 50 or had symptoms like that, you start developing certain symptoms around that time or so, being a little bit cognizant of what your body's going through, because sometimes we just have patients, they come in, and a lot of times we see it in the ER. Something made you come to the emergency room, that you had this chest pain kind of before, but what is it this time that actually brought you to the emergency room, or what made you so concerned? Other things could be not necessarily just the chest pain. How we had discussed earlier, women can tend to have different, just how they have different risk factors or can present at different kind of stages. They can also present with different symptoms as well too. And those can be atypical symptoms such as just say some shortness of breath, some abnormal fatigue or so that they've been having. Other things, just how we were saying earlier, what's going on with their blood pressure? Why are they having difficulties with all of a sudden blood pressure control now when they're doing well with it?
It's important to know that chest pain can be caused by anything, right? So it could be muscle, it could be your lungs, it could be your heart, it could be the space in between your muscle spaces. So if you have pain that's lingering it's a time to talk to your doctor, your cardiologist, just to make sure you get seen to get the workup needed. Because sometimes, you don't want to wait for too long until it's too late, right? So if your pain that's going every single day or every other day, pain is worse with exercise, and it gets better when you rest, it's time to see your doctor.
And I also want to add that chest pain is extremely individual. Like we're talking about chest pain, but I have people telling me, well, it's not a pain. I don't have a pain. I have this pressure. And I'm like, well, tell me about the pressure. Or I've had people describe all kinds of discomfort between their jaw and their belly button that when we really dig it apart, it kind of is chest pain, but maybe they're not calling it that because it's not a stabbing pressure in the left side of their chest. But any sort of discomfort here is something that you should talk about with a doctor to make sure that we're really picking apart, is this your heart or is it something else?
Yeah, and I would say in the line of self-care and your heart and self-care to make sure you're getting it checked out. I think it's really easy to push stuff off. I think it's really easy to say, oh, I'll go tomorrow. Oh, I'll wait till it gets worse. And we really want to encourage people to make sure that if they don't feel well, if something is triggering them to say this isn't right, to go and get it checked out. Because so much of what we see, I mean, you guys know, especially when it comes to heart attacks and stroke, time is so important. And the time it takes, the longer it goes, things like that can be so deadly. So we really encourage people to make sure that if they are, to put their self-care as a priority and to make sure that they are in fact going to the doctor, getting it checked out, making sure everything's okay.
It's important to listen to your body. And then when it's talking to you, you do something about it and don't just let it go.
Another thing too, maybe your spouse, because a lot of times your spouse picks up on stuff that maybe you're not too keen on or so. You're walking up your flight of stairs, you're getting up there and, she's like, why are you huffing and puffing a little bit more or so? Or why do you have some more swelling in your legs? Things like that you may not be, kind of privy to yourself, but someone else who really cares for you might be. So
I also want to make sure we mention the atypical symptoms that women tend to get. So it can happen for either gender, but it is more classic for men to get sort of that left-sided pressure with sweating and down the arm that we see on TV when we depict heart attacks. But women tend to get a lot of GI type symptoms. They'll come in with not even thinking they're having a heart attack, but rather this burning feeling, and I took my Tums and I took my Pepcid and nothing is working. And we see that their EKG is normal and their heart enzymes are elevated. And usually they're completely shocked to find out it may be their heart, because to them it feels like a reflux burning pain that's been persistent. So if you're someone who has reflux and it's coming to be persistent and like, why aren't my medicines working, make sure you talk to your primary care doctor to, do you think this could be something else, or is it just an exacerbation of my reflux? But that's definitely more characteristic of women, and that's why sometimes the diagnosis gets missed.
And how Christina's saying primary care doctor, going on that point, I think it's very important that everyone should have an established primary care doctor, even if you think you're healthier. So at least yearly, get yourself checked out, especially if that's the only time a year you're getting your blood pressure checked, you're getting yourself properly looked at. That's a very good idea, and that'll help you stay proactive in your health.
The other thing that can be your heart is, your heart is racing all the time, or your heart is skipping a beat all the time. Sometimes you cannot lie down flat. Okay, sometimes when you sleep at night, you're very sure about until you sit up straight. Sometimes your legs are swollen. Your shoes are not fitting anymore. It's the time to see your doctor, see your cardiologist to make sure you get workup done.
Wow. Okay. When a patient goes to the cardiologist, what are some things that they can expect? And I know you guys have actually mentioned a couple things that you guys look for, but what's the expectation?
An EKG.
Yeah.
An EKG.
Get an EKG and expect to, talk. We want to try to get as much information from you that we can. That comes from the reason why you're there and going into the exact symptoms that you're having, what's going on with that, a detailed family history, and then a detailed past medical history of were you ever hospitalized? If so, for what has been going on with you that we need to know. And then obviously we're going to check your blood pressure, complete cardiovascular workup, listening to your heart, lungs. And then even at times, don't be surprised if trying to feeling throughout your body for all the pulses, making sure everything's symmetric, that the blood flow coming down your right leg seems and feels as good as what we're feeling in the arteries of the left leg. You know, those are things that we can do to kind of help keen us into, is there something maybe abnormal going on?
Also, if you're going to see a cardiologist, especially if it's for the first time, if you've had some recent blood work, bring it along, because that can take some diagnoses off the table right away. Things like your thyroid, your cholesterol, your electrolytes, liver panel. If your primary care doctor has been awesome enough to order these recently, let's have them right in the office so that I can answer some questions that I'm having in my head as you're talking to me about how you're feeling. So bring along your blood work, or if you don't have any, we might draw some, which is an expectation for the visit too.
Mm-hmm. And then if anything sounds alarming, or we want to look at things further, we would follow things up with further testing yourself. So if you're coming in, you have risk factors, you're having chest discomfort, possibly a stress test depending on the way or modality we would need. Sometimes we even use CT type of scans as well too to further evaluate you, and ultrasounds of the heart to get a good idea of the picture. And that also gives us an idea of the way the blood flow is working through the heart, what the valves look like, gives us an idea of what the pressures inside the heart and that are dealing with as well too.
Okay, well, I think this might be a good time to open up for some questions from our attendees. If you guys have any questions, you can, you should be able to raise your hand or send me a chat real quick, and I can unmute you. Give everybody a second. I feel like you need that music. All right, well, while we wait for some questions, is there, here's a question.
Say, I got a question pop up.
As I see that. Okay. When the doctors were talking about the 7 things to help with heart disease, they never mentioned about cod liver oils or apple cider vinegar. Does that help? Interesting question.
So I'll take that. So the question is, what is the indication here, right? So we've seen people using cod liver oil, apple cider vinegar for weight loss and other stuff. There's some data, but it's not that strong. So before you go, like we said, before you go any diet, any medication, just make sure you check with your primary care, your cardiologist, just to make sure you're okay with it. Apple cider vinegar, something can be very caustic to your esophagus, your stomach. So just be very, very careful before you put yourself on it.
Whenever we prescribe a medication or supplement, whatever it may be, we want to make sure that it's going to give the patient true benefit. So when we recommend something like atorvastatin or Zetia to lower cholesterol, it's because there are studies that show that people have less cardiac events, less chance of dying or having a bad outcome. So we really try to keep our medicine to what there's evidence to support.
Like that, in terms of the cod liver oil, I think you can just maybe extrapolate, since it's coming from fish. Fish are healthy sources of good fats. But the other thing about that is, like how Dr. Ankita had said, there is not robust research or any big trials that go into this, like how we do know with the statins, and we do know the benefits that we clearly get from that. There are certain analogs that kind of can mimic what the fish oils and that do, but those are pharmaceutical, and we know, and those are been made in the lab and tested. And those have been tested and are showing promise and some benefit in patients, especially more in patients with different types of lipid profiles and other risk factors as well too. But with the apple cider vinegar, I don't think there's any real rationale or data to support any need for it, especially in terms of cardiovascular health. And the other thing too is a lot of these things are not regulated. You can go to one pharmacy, buy over-the-counter cod liver oil, go to another one, it can be completely different and not know what type of processes are going into making these products?
There's a lot of herbal medicines and teas and stuff that are promoted heavily, but not only the benefits are not really known, they're not studied, but then their effects on the medications that you may be prescribed from your provider, there may be interactions that are unexpected. So if you're taking any kind of medications, herbal medications, you need to include those with your list of medications so that your provider can establish whether or not there's going to be an interaction before prescribing a new medication for you.
I don't know about the idea of doing apple cider vinegar. Oh, okay. Not too long back, I started feeling a burning sensation in my stomach that never really went away. But I took an aspirin and I felt better the next day. Is taking aspirin every day a good idea to start?
Well, that's a little bit of controversial as well, too. What we do know is that patients who need it and have a benefit from it are going to reap the benefits from it. So those are patients who we know that have a history of a prior heart attack or coronary artery disease that we've seen either by abnormal stress test or possibly imaging, and we see that there's some plaque in the arteries. They could benefit it for, say, secondary prevention, or even in the patients who just have some stable plaque, primary prevention as well too, patients with strokes. Let's say the patients who are at low risk for these might pose a higher bleeding risk. And the thing about this is the data always kind of sways to the right and left, especially it almost seems like yearly, depending on who's looking into this as well too, or especially even what part of the world you're getting the recommendations from.
Right. In fact, it's harmful for most patients to be on aspirin daily, except if you have like heart attack, stroke, and other stuff. So make sure before you go on aspirin therapy, you talk to your cardiologist, talk to primary care doctor, just make sure you're okay with it.
Yeah, absolutely. Absolutely. Okay. How does the panel feel about a balance of natural supplements or nature supplements or any multivitamin supplements?
A lot of the vitamins actually does have very poor absorption. So people actually take them. The benefit is minimal. But just to make sure, things like vitamin D, B12, if you check your levels and they're low, it's okay to replace them. So again, talk to your doctor, make sure you check your levels. If they're low, you should replace.
And for the most part, a well-balanced diet will get you all the nutrients and everything you need, unless, like how Dr. Antia said, if you have any type of malabsorption syndrome or so, where your body's not able to take these certain vitamins in, but sometimes it can also be harmful for you. There's certain vitamins that can stay within your body that can, at high levels, be pretty toxic. Cause liver failure, things like that, in particular with the vitamin A, vitamin D, those can.
If there is a supplement that someone wants to take, but maybe like we're mentioning, there isn't strong data for it, it doesn't have to be black and white. You can still bring it in. We can discuss it. Is it going to be harmful for you? Is it going to possibly help you? So like I said, it doesn't have to be black and white. If you feel really strongly that you want to start a supplement, just bring it into your doctor's office, bring the actual supplement with you, and we can talk about it, look at the medicines you're on, and just make sure that it's something that's at least okay to try.
Chris, did you have something?
Just talking about the balanced diet, eating a colorful meal, colorful foods in your diet will give you a lot of the vitamins that you're getting out of that bottle to begin with, and you're getting it in a form that your body is ready to absorb.
Good point. Good point. Definitely good point. Any other questions? Is there, we have a couple minutes left, but is there anything that you guys as the panel want to address regarding heart health and
I think sometimes patients show up too late. For instance, I had a patient, he's 54 years old. I just saw him last week. His A1C is almost 12. Okay, he's got bad diabetes, bad blood pressure. He never saw a cardiologist, never saw a doctor, right? So I think it's important you start early as 18 years old, right? Make sure you're getting your blood pressure checked, your cholesterol checked, make sure you're not diabetic, just to make sure we don't get lost, basically.
It's easier to control these things when you're approaching the pre-stages of this to when sometimes it's, you know, we have progression in medicine to where it could be almost end stage, and now we're just playing, you know, keeping things going and stable.
I think knowing your numbers is important, you know, your cholesterol, your blood pressure, watching them. And if you know you need to make a change, start making your changes, but make them small and steady.
Yeah. We did get another question. What about women getting jaw pain as a symptom?
And that can be
Jaw pain can definitely be some radiation from a chest pain or a type of angina. The question is kind of like chest pain, what brings it on? What makes it better or worse? For example, if it hurts when you chew more, maybe it's more of a muscle thing here, something to talk to your primary doctor about, but it certainly can be related to the heart. But there are some more questions to follow that.
Anything else we missed?
Can I add one more thing?
Oh, yeah.
Something that I'm always telling my patients, which I think is important, we're kind of focusing on getting people in the office, but I want to make sure that people understand that there's no such thing as autopilot with your heart. You can't come in and maybe get Lipitor and lisinopril and then just not come back for a long time. Like I said, you can't just take these medicines and you're good. So it is important not to autopilot, rather to keep constantly assessing your symptoms as they change. Symptoms are very dynamic. They will change as you grow and change. So even if you think you're not having any issues with your medicines or your heart, it is important to just check in and go over things, because we're going to pick up on things, like Dr. Nketiah mentioned, a lot sooner than you might, by the time that you have symptoms or your medicines that you've been on autopilot with for a while are not doing their job anymore.
Wow. Another an anonymous came through with, my doctor wants to put me on a statin, but it gives me body aches. Is there anything I can do to help with that? That's a good one.
Right. So the first thing, like we talked about, the diet is important as well. But there are a lot of options for cholesterol, right? So statin is just one type of medication. You can try. There are things like ezetimibe, there are things like Repatha that we can try. So that's just one medication that we can try. So if that's not working for you, we can try something else.
And there's different statins within the family of statins that we can try as well too, where we do know a couple or a few of them tend to cause less of those muscle aches or pains, just in the structure and the way that they're made up, and the body's kind of utilizing them as well too. And then this can also go back on that point when we were talking about supplementation or so. So I think back more in the past, coenzyme Q10 was prescribed a lot to these patients, or suggested. You know, it's hard to say, but the way the rationale came, the way the metabolism for the cholesterol is, coenzyme Q10 is a cofactor needed in that metabolism. So maybe by supplementing that, you're not taking away that negative effect that the cholesterol or the statin medications are providing.
All right. Well, before I share some, and you know, questions are still open, so if there are any, please feel free to ask. Oh, my doctor suggested a beta blocker once a week. I have periodic fluttering. It was also recommended that I take magnesium. Is the magnesium a good place to start?
Well, it can be. Did it help? You know, like you can see, you're taking some magnesium. Magnesium is just the elemental, just native to what we take, and our body needs certain levels of it. You know, sometimes it's hard to say someone who might have a normal level or borderline level, their body might react differently to that. Where magnesium not necessarily is going to completely harm you or say per se, but that's something you'd want to talk with your physician about and see. And if you are getting help from it, your other levels, things are staying stable, your magnesium levels aren't significantly elevated or so, I think it wouldn't be unreasonable. And the other question with the beta blocker taken weekly, that's, it could also depend. Say if you're having a day where you're having more or that's a day you're feeling it, you can take it as needed. But if it's something that's happening every day, you're tolerating the beta blocker, you're not having any issues related to sometimes say low blood pressure, things like that, it might not be unreasonable to stay on the beta blocker daily just to prevent any reflex episodes or periods from when your beta blocker starts taking or stops taking effect that can cause those symptoms.
All right, I have a question, and I'm so glad it hasn't come up yet exactly. And we had a great discussion around cardiac and heart health, but how has COVID impacted cardiac health? Have we seen any correlations?
I think
Oh,
Dr.
and
did it the
I'm
best.
really worried. The question just came through. I'm really worried that I won't be able to tell the difference between COVID and chest pain. How can I know the difference?
Good question, Jerry. So we've seen a lot of patients with COVID and chest pain. So there's inpatient people with chest pain and COVID, and outpatient people with COVID and chest pain. So inpatient tend to be much sicker. They have troponins or heart enzymes are elevated. Sometimes if you're on an EKG, it's abnormal. If you do a cardiac ultrasound, it's also abnormal. Then there's the outpatient one, tend to be younger people that have normal troponins, normal EKG, normal cardiac ultrasound. It's hard to kind of figure out what's causing the chest pain. So that's the key is make sure you get seen as soon as possible. Like I said before, chest pain could be anything, right? So the key is to see a doctor, get the EKG, make sure it's not a heart attack or something else, right? Then we can take up COVID symptoms. That's very important to do.
And the question is, if you know that you're infected with COVID, patients with COVID, we do know are at increased risk for developing blood clots. We don't know where those blood clots can be, so it's hard to say because we've had many patients that they come in with COVID. You don't expect them to have the typical risk factors or anything to have, say, coronary artery disease, and lo and behold, they are suffering also from COVID and a myocardial infarction. And we've seen plenty of those patients here, and then just delineating how to treat them, obviously with the medicines or so, and seeing what their risks would be. So it's always a good idea to get it checked out if in doubt.
Right. So like you're asking about differentiating heart pain from COVID pain, but it doesn't even have to be one or the other. It could actually be both. So you can have COVID-19 and that can be complicated by a heart attack. So if you have chest pain, regardless of the cause, you need to talk to a doctor.
COVID-19 has affected so many people in such a wide range of ways, from respiratory to cardiac. We've seen anecdotally a number of our staff come through with needing to have their blood pressure medications changed because now that after COVID, their blood pressure is higher than it was during their maintenance period on their medications. So we have been encouraging them to follow back up with their practitioners so that they can, make that decision on whether or not they need to have medications adjusted.
Okay, well, anything else to add? Otherwise, I'm going to share my screen. Are you guys all seeing that?
Yeah.
Oops. All right, so for more information or to schedule an appointment with either Dr. Patel, Dr. Ankatia, or Christina Hahn, who are obviously Garnet Health doctors, here's their information. Dr. Patel is located in Sullivan County at the Garnet Health Medical Center Catskill campus in the ambulatory service building on the 3rd floor, and his number is listed there. And Dr. Ankatia and Christina are located here in Middletown in the outpatient building on the 4th floor, and their number is listed there. We've also included our American Heart Association Tri-County Heart Walk, and that QR code right there is so you have the opportunity to sign up and participate. Please sign up and participate. And if you have any more questions or you want any more information on garden health, cardiology, and healthcare services, you can follow that link there below. So I just want to say thank you so much for everybody who joined us this evening. Thank you to our amazing panelists. I think this was a great discussion. You know, a nice refreshing topic and a nice way to end Heart Health Month of February.
Thank you so much.
Thank
for
you.
inviting me.